Welcome to Social Work Matters. We have a special guest with us today, Dr. Ayrin Hnosko, and she is going to be speaking about her practice specialization, which is trauma. And I so appreciate you being here today, Ayrin. It's great to see you. And we actually
Absolutely.
met several years ago during our doctoral studies and became fast friends. And she is definitely an expert in this field. So we are grateful to talk with her today. So, Ayrin, if you just want to start us off and share what inspired you to become a social worker and then move into this trauma specialization.
Yes, thank you for having me. I'm so excited to be here and to be with you. So, what brought me to social work is quite odd. I wanted to go to college and I was taking classes and I decided to become a history professor because I love history and stories. And then I got into psychology 101 and it was like a lightning bolt hit me in the middle of class and I realized crap, this is what I'm meant to do. I'm meant to do something with humans and helping humans, but I still love stories. And I got through my bachelor's degree in psychology, and someone mentioned as I was continuing on with education, have you considered social work? And my exact face and response was, "Mm." And they said, no, honestly, look into social work. And here I am. I got a master's in social work from Widener University. I took a few years off and then pursued my doctoral degree in social work. How I came to specialize in trauma was another moment. It seems to be a theme. So I remember being in our master's program and thinking, they keep using this word. They keep using trauma and they used it so much. And I was like, for the love of goodness, like, please stop with the word. And finally, I decided if I'm having such a reaction to it, I should probably look into it. So I looked into what trauma meant and what it meant in social work. And then I was hooked. And the more work I did in the field and in my own research, I realized that the way that I think is through a trauma lens. So I'm able to approach people in my private practice, our students, the kids that I work with in the schools. I'm able to approach them with that lens. And it's become my specialty, but also my identity of sorts. It helps me see the world differently. So I came into it by accident, both social work and trauma, but I am meant to be here and I love it.
Awesome. That's so powerful. Thank you for sharing that. And can you explain a little more for folks that might be listening who are not familiar with trauma? Can you explain what trauma is?
Yeah, so there are probably 100 definitions of trauma since about 2004 when it really started to hit mainstream publication. So we had a lot of research being done in the 1990s about trauma. Not that there wasn't research being done before that, but it really started to kick up in the 90s. And then in the early 2000s, we had more mainstream stuff coming. So trauma's got 100 different definitions. The way that I define it is probably a little bit more general. And how I define it is experiences that happen to an individual that change them in some way. And it is not the experience necessarily that is trauma, but instead what happens within the person that is the trauma. So a person can experience something that another person experiences and have very different reactions and very different realities and even different memories about the event. In my estimation, you can't call both trauma if one is not impacted in a way that is traumatized or they're not traumatized. So it's about the experience within the person. And one of the things that I was thinking about is the more research I do, the longer I'm in the field, the more I realize that trauma is a fundamental human experience. It just happens to different degrees. And I think how we view it is how people experience and process it individually.
Yeah, absolutely. And can you talk more about the difference between trauma, like we might think like violence or accidents, crises versus other kinds of trauma?
Mhm. Thank you for asking that. That's really important. And I think it gets lost in a lot of the literature about trauma because people hear trauma and I think a lot of people associate it with the diagnosis of PTSD. So they think trauma equals PTSD, and that's not actually accurate. So as the field evolves, we learn that trauma can be a singular event that impacts an individual over a short amount of time and that they work through, like a post traumatic stress disorder. But the specialty that I work within and that I try to educate people on and that I see more often is complex trauma. So, complex trauma meaning either smaller experiences that happened over time. And I don't mean not important by smaller, I mean less newsworthy, we'll say. So, abuse, neglect, things like that. The things that slowly deteriorate a human over time, those kind of experiences, and or early fundamental childhood experiences. So the experiences that we don't always have memory for, we don't always have recall for. I think I focus a lot on all trauma matters. It's all important, but there's less education, I think, about complex trauma, the trauma that is pervasive over a lifetime. And that's what I try. That's what I'm most passionate about. That's what I try to educate people on.
Speaking about education, can you describe or help us better understand what are maybe some misconceptions about trauma?
More than anything, if I could have someone take away anything, it would be that trauma is not just big events. It is more than that is a chronic stress. It's a systemic thing, right? It's something that is happening to a human being that impacts them socially, psychologically, financially, career-wise. I think I said physically, but maybe not physically. Like it affects every realm of a human being. And I think the misconception is that it's a one and done type situation. If a person has a traumatic event, then that is the traumatic event and that's what we're going to focus on, and that a person's behavior 10 years down the line that seems erratic in a grocery store is in no way connected to that trauma or any other traumatic situations. It's all connected. It all matters. So I think the misconception being first that it is just one singular event, and also that the behaviors or things that happen later down the line are not directly connected into that systemic concern.
Yeah. Yeah, absolutely. That's important to know. So tell us more. You specialize in trauma practice. What does that look like? What do you do?
I think because I love to learn and read and research, and I still love stories, that what I get to do is I get to hear people's stories. And the most wonderful part about social work is witnessing people's stories, right? So I get to sit with individuals, whether they are my clients, my students, family members, community members. I get to sit, and first and foremost, I get to be with them in the moment. And that may seem like a small thing, but in this world where everything is instant and people don't feel heard and don't feel seen, the very act of me sitting in a room or online with another individual and being fully present with them is the first step towards healing. I provide an important service by doing that. Then I establish a trusting therapeutic relationship with them. I'm really lucky that I'm able to do that most of the time. And that relationship in and of itself is a healing relationship. It can help heal some of the traumatic experiences that individuals have had. Also, it's in the therapeutic relationship is where some of the stuff comes out, where some of this trauma stuff comes out, and you have to work through that. So I use the therapeutic relationship as a container and as a modality for our work together. So it's about listening to their story and hearing their story and validating their story. But I'm big about education. So I'm going to sit and I'm going to hear and I'm going to listen and I'm going to be with you for that. But then I'm going to teach you what's happening inside of you, why you feel the way that you do, how this physical ailment that you think is not at all connected to what happened 15 years ago actually could be based on science. So I try to bring all of the research in. I try to educate in an appropriate time to let them know that it's not their fault. They didn't do anything to cause this, that the feelings that they're having are valid, expected, anticipated. Just because society doesn't understand it doesn't mean doesn't make sense. So I think throughout the whole thing, I look at everything as if someone has experienced trauma. How would I treat an individual if they were experiencing trauma? And that's how I work. I try to show up. I try to be present. I try to be mindful. I'm not always perfect, but I use the relationship big time, and I use education. And I have so many clients to say, Ayrin, do not give me another book to read. I say, okay, fine. I'll just give you the Cliffs Notes version.
Yes, I remember you are a big reader and love books. That's definitely
Yes.
an important tool to use for sure. So, do you work with children or adolescents, adults? What populations?
Throughout my entire career, I have worked with all ages, literally from the ages of 2 and up. So that's been a pretty consistent theme. So currently, I work with preschool age children all the way through adulthood and later adulthood. And how I do that is through school systems, private practice, and teaching. So there is no set of people that I don't work with. I don't have a specialty in that because I see the lifespan as, I mean, trauma can show up at all points throughout the lifespan. So it always feels to me that no matter where I meet a person in their life, that I can work with whatever's going on or what happened because trauma is always there, kind of thing.
That's a great point. And I'm wondering too if you can share any memorable or a specific moment that really reminded you of the impact of this work. Of course, not breaking confidentiality, but anything particular that we can understand or learn about this work.
This is a story that I actually reference a lot because it is small but powerful. When I first got into one of the schools that I'm working with, this is an underserved population that I'm working with. So they are very resource poor, meaning that there are a large number of citizens and not a large number of qualified mental health professionals. And then the number of qualified mental health professionals that specialize in trauma is even lower. And this is a high trauma dense area that we're working in. So I go into the schools and I provide care for students there. And there was a student who was your typical, what you would think is an angry, angsty teenager. He would blow up in class. He would walk out of class. He would walk out of the school. He would walk down the road. He would curse out teachers, the kind of kid that people bristle against, I think. I'm grateful that I'm wired differently, I think. I don't know if that's good or bad, but I'm wired differently. So I see a kid like that and I don't go, ooh. I go, okay, I've got this. How he was brought to me was he was having a really, really hard time and he felt like he wanted to end his life. So I had to talk to him about that and to clear him psychiatrically. I sat with him for 3 hours the first time we met. He wouldn't talk to me for 2.5 of those hours. So we just sat together. And the fact that he didn't get up, he didn't yell, he didn't scream, he cried a little bit, but there was no outburst. He just sat and I sat with him. Every once in a while I'd poke in like, how you doing? Can I get you some water? But we just sat. I knew that he needed a space and I knew that he was going to be willing to open up and I knew that he needed it. So I just sat with him. And the child or the teenager that eloped and left rooms, we found out why. And so instead of making him sit in a therapy chair while we're in school, I walked with him all over the school grounds over and over and over again, and often with really poor shoe choices on my part. That sustained him so that last year he was able to graduate. Yeah.
Wow. That's must be a rewarding experience to see
Yeah.
that.
Yeah.
What
And
a success.
seeing that happen, seeing him, I mean, there was so much that happened in the interim, right? But to see where we started and then see him walk across that stage was an amazing thing. And even better, this is going to sound odd, but even better, I went later on to like congratulate him and he so didn't need me. And he was like, I'm good. Have a good day. And that was great because we did what we were supposed to do, right? We gave him the tools and he's off and he's living.
Yeah. So powerful. That's
Yeah.
awesome. That's awesome. Well, so that's a rewarding experience. Maybe talk a little bit about like what's hard about this work, what's challenging for you.
Challenging is, again, I'm working in a resource poor environment and there is less resources and less education surrounding mental health and trauma in the area that I'm working with, and a lot of embedded belief systems that we're working with. Another reason why I love social work is that we aren't ever just about the person, it's about the community and the family and the micro, meso, macro. I'm always looking at that. And so when I have students who come in that tell me they don't believe in anxiety, or that what happened to them isn't traumatic, or they were told by their family members that what happened wasn't traumatic. I have a lot of work to do to educate very gently and fairly in an area that doesn't necessarily subscribe to that kind of thing. So I feel like in some ways, although you could never put me on a show, I'm dancing a lot in social work because I'm always trying to figure out, how do I educate and be here for this individual and not step on their belief systems, not blow up their belief systems, not make ripples in the family, right? In the community. Because if they go home with, well, Dr. Ayrin said this, that can cause some significant issues. So I feel like one of the hardest things is, how do I take care of my client without blowing up their life kind of thing.
Yeah. Yeah. That's a good analogy with the dancing. Yeah, definitely. And how does trauma affect communities, or is it just impacting individuals?
Yeah, thank you for asking that. It is super important to remember that, first of all individuals are part of a system. They're part of many, many systems. And because our systems are created and made up of humans, that the trauma is a ripple effect. So trauma is everywhere. Systems are traumatized and create trauma. Communities are traumatized and create trauma. And I know that might sound really cliche because the word gets used a lot, but the truth is that when we look at agencies, we look at communities, we look at family members, and we see different ways that they've coped and different things that they've done, and how that isn't really working, and how that's maybe more detrimental to people's mental health. You can't help but acknowledge that that is a trauma response, right? Like, people are responding to and from experiences that push people off kilter. I know that I'm biased, but I see it everywhere. And because I see it everywhere, that could be really depressing, but I see it everywhere. And that to me is hope, because that means we know how to fix that. In social work, we know how to fix that.
Yeah, that's powerful. Thank you. And I'm curious too, what are some practices or ways that people can support either their mental health, or maybe even how larger systems can support people experiencing trauma?
So this is going to sound probably very simplistic, but I truly think that we do have to go back to the simpler things, because in some ways I feel like many, many people, I mean, I deal with this all day, every day. People feel unseen, unheard, not understood. I think we have to go back to sitting with somebody while they're having a hard time, not trying to fix it, being there, being present with them, asking for help and being able to receive help. A lot of people ask for help and then they're met with somebody not listening, or somebody not understanding, or somebody having their own judgments. It's really hard to step out of that, but it is necessary. It's the first step in developing a therapeutic relationship. People have to feel safe, right? I always reference Maslow's hierarchy of needs. If our clients do not have water and clean air and they don't feel safe in their environment, there is no way that we are going to be working on these issues that are deemed more important in times of, like, whether they can access higher education or not. They have to have those needs met before we ever go beyond that. And that starts at home as parents. It starts with our family, with our friends, with our schools, with our neighbors. It's simple, but not. Because if it was that easy, I guess we'd be doing it.
And I think that leads into, people like you who are researching and specializing this to increase all of the access to care and services. So that's great. And you mentioned about teaching. So how does that fit into your work with trauma?
So I feel like I teach every day because I learn all of this information and then I need to talk about it. So in session, my poor children, my poor husband, like, they have to hear it all the time. So I feel like I just walk around, maybe not teaching, but I'm certainly giving out information. um, I'm the person at the cocktail party that's not like, go sports. I'm like, did you hear about the new research in neuroscience and trauma? By this point, people just anticipate it, but I'm the weirdo that does that. So I feel like I'm always teaching, but I have an amazing opportunity to teach at our university. I love doing that because I get to be with students who are pursuing master's degrees in social work. So they've already decided that this is their thing. but they're at the beginning, right? And some of them don't even have experience yet in the field, and they're overwhelmed, or they're confused, or they feel like they have to know everything off the top of their head. Like, when I come out with my master's, I will know all therapeutic modalities. And that the number of times I have to say, no, you don't. I'm passionate about that. And I think that I'm using trauma informed care with my students as well. And how I do that is when a student says to me, Dr. Hnosko, I couldn't complete this assignment over the weekend, fill in the blank. I'm not asking questions. Okay, you're an adult. you you're telling me you're having a hard time. It's not my job to figure out whether that's a hard time or not. I'm going to believe you. I'm going to support you, and we'll work together and we'll collaborate just like I do with my clients. And the feedback I've gotten is really powerful from them. Like, thank you for being understanding. Thank you for not questioning me. Thank you for not thinking I'm making it up. And then, you know what? This is the thing. You can't learn if you don't feel safe. So if I harp on a student about you're not getting something in on time, if whatever, they're not learning. They're not learning anything I say. They've got a bad taste in their mouth about trauma in general, or about the material, about the book. That's not my intention. My intention is for everybody to come out of the courses that I teach with a love for learning about something in social work. If it's not trauma, that's fine. But I want them to come out and I want them to learn about it. So I lower the stress levels and I increase access to the information in any way that I can.
Yeah. That definitely sounds like a parallel process to the practice you described. Yeah,
Yeah. Yeah.
absolutely. That's great. So, with students in mind, is there any advice you would give to these emerging social workers as they enter professional practice?
Yes. First of all, as a student in social work, you are so very needed. You are so very, very needed. I hear a lot of worry, especially in, in the climate of the work net or job networks and how they increase and decrease. And there's always concern about whether, will I have a job? Will I be able to pay my bills? Will I make a difference? And because I've been in the field for long enough, I can confidently say you are needed, you are wanted, you bring something to this field that is absolutely necessary, that isn't there already. And therefore, with those skills and gifts that you bring, you will make a difference. You will make a difference for the people that you work with, and you will make a difference in the community. And I don't think we can ask for more. You go for an education that essentially is a degree, but really it's life. Like, we're giving our students life so that they can help other people live. And I know that might sound dramatic because it's a degree, but you're teaching people how to live and how to be human and how to treat other people like humans. I would say you're needed, you're wanted, you will always have a job. You will maybe have more jobs than you want. um, you do not need to know every treatment modality. I express a lot of this with my students. Find two or three or one or four, the ones that like really pop for you. And you're like, wow, that sounds really interesting. And do more research on that. There's things that you're going to come across. You're like, that's interesting, but that doesn't spark me. If it sparks you, look more into it and get to know that. Don't get to know everything. You're not going to.
It's the truth. Yep, yep. I can remember feeling those feelings myself when
Huh?
I was a student. Yeah,
Yeah.
definitely. That's great advice. Thank you.
I said it to one of our students last week on supervision. She said, "Oh, I don't know how I'm going to ever remember all of the things I'm supposed to do in treatment modalities, like what I should use when." And after I giggled a little bit really quietly, I said, "Have you ever been to your primary care physician?" And she's like, "Yeah." And I said, "Okay, when you go to your primary care physician, what do you go there for?" She's like, "Well, if I have a cold or if I have the flu or if I broke my pinky or, she gave me all these things." I'm like, "Yep." And that's a generalist practice, right? And she said, "Yeah." And I said, "So if you broke your pinky, but it was really wonky, would you go back to your primary care or would you go to a specialist about that?" And she was like, "Well, I think I'd go to somebody that works with bones." And I said, "Right." So in social work, we're first and foremost a generalist practice. We know a little bit about a lot of things. And then if you decide, I really love this part of social work, like me, then you go with that. And then you specialize in it. But in the beginning, you're knowing a little bit about a lot of different things. And then the field will show you, the world will show you, your research will show you where you're meant to be.
Absolutely. That's another great analogy for sure. And that's how the MSW program curriculum set up. The first year is your generalist year where you are learning all of these different things. And then you can move into your specialization, your area of interest in that final part of it. For social workers that are in the field, mental health professionals, do you have any advice for them about caring for themselves in
Yeah.
this trauma rich field?
Yes. 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 So first and foremost, self-care gets thrown about like confetti at the Eagles Super Bowl parties. Like, it's everywhere. Social workers are told self care, self care, self care. And I want to challenge that a little bit. What it's become is this idea of like, well, I'm going to get a massage and that's great. If that works for you, that's wonderful. But people will say to me, like, how can I do that? I don't have time. I don't have the energy. I don't have the resources. How am I supposed to do these self care things that, I'm either not interested in, can't access? And to that, I say self care is not one particular thing. Self care is being present with what's going on inside of you, tending to your nervous system, which is going to take some education and some time. But whatever it is that fills your cup, that is self care. And that is necessary and vital to remain in this field. It's not a luxury. It has to happen, but it doesn't have to be expensive and it doesn't have to be, you don't have to go away for 6 weeks to a silent retreat to get your self care. Sometimes it's 5 minutes screaming in your car or listening to your favorite musical on the way from work or listening in silence like I often do. It is finding what works for you and then putting that in within your day. 5 minutes, 2 minutes, 1 minute. I have been meditating for 3 minutes every day for 5 years and I've never increased it because 3 minutes is what I started with. That's what I knew I could do. And that's what I've been doing. And that is a part of my self care. It's not extreme. It's not extensive. It doesn't cost me anything, but it's 3 minutes I can consistently do. So I say, do it small, do it often. And that will keep you taking care of yourself. And also recognizing that everybody is at a 10 right now in the field, in the world, in Acme, right? We as social workers are really, I think, gifted at recognizing that and reading the room, right? And so we take that on a lot of times. But to that, I will say to fellow social workers, do a good job of remembering that everybody's at a 10, but you don't have to be at a 10. You don't have to be. Yeah, it's crazy. It's always gonna be crazy. This is crazy, like, there's always a crazy. But, you don't have to get swept up in it. You can take care of yourself, you can take care of the people around you, and the little work that you do is gonna ripple out and make a difference.
That's great advice. I appreciate that for sure. Well, Dr. Hnosko, I appreciate you talking with us today, sharing more about your work in the field of trauma. And I'll just ask maybe as we end here if there's one message or one thing you want our listeners to take away or walk away from this podcast that you would like to share.
Well, that's hard. I think the thing that I'm focusing on right now that I'd like to impart to people listening is I have this tattoo. I don't know if people are gonna be able to see it. It's on this arm.
Yeah, I can see it.
It's a matchstick and this is a lit, right? And that comes from a very popular song, but it's about one moment, one thing that you do. One match can make an explosion. So something I've been focusing on when everything else seems out of control is what is one thing I can do right now that is going to make a difference down the line, even if I don't know what that looks like, even if I can't see it. What is one thing I can do? And sometimes for me, that's as simple as making sure that the coffee pot is ready for the next morning so that I have hot coffee on my way to work so that I'm not a monster when I show up to work. Or, like I have several cans of food in the pantry that I know we're not going to eat and donating them to a local food pantry who they're desperately in need right now, food resources. One small thing. You don't have to rearrange your life or the world. You just have to start with one small thing. And that will make a difference. If we all do something small over and over and over again, it will change the world.
Yeah. That's a great message and a message of hope for sure. Dr. Nosko, I appreciate you. I appreciate your expertise, and thank you so much for spending some time with us today.
You're welcome. Thank you, Dr. Strayer. Have a great rest of your day.